The supraspinatus muscle can not only be treated indirectly through the trapezius muscle which lies superficially, but there is a possibility to reach it, at least partially, in the ventral area directly. For that, first we identify the trapezius muscle, the whole ventral part of the trapezius muscle, and at the front edge of the trapezius muscle, first I search, as technique 4, the superior angle of the scapula. By pushing the scapula cranially and caudally, alternatingly, I feel the superior angle of the scapula, bony, hard, coming towards the middle finger of my left hand. So I am now anterior to the trapezius margin at the superior angle of the scapula. If I move my finger from this fixed point laterally and stay on the front edge of the trapezius, or go laterally from the superior angle of the scapula, I get to the supraspinous fossa, to the origin of the supraspinatus muscle, and thus I can directly reach parts of the supraspinatus muscle by digital palpation here. We have a combination of different techniques here. On the one hand, I have a fascial separation technique between the trapezius and the supraspinatus muscle, a technique 4, and if I find active trigger points here, in the ventral part of the supraspinatus muscle, I can just treat them now with a technique 2A, for example. It is also possible to carry out the technique 2B here by practicing the same axis and reaching the ventral part of the supraspinatus muscle, and then ask the patient to move forward with his hand, to carry out abduction, and then to reach the back with his hand and to move forward again. Please continue. While I stay here with the left hand at the trigger point in the supraspinatus muscle. Please repeat it 2 more times. Technique 2B at the supraspinatus muscle. And take a break.